Good afternoon, everybody. I'm Tiffany Craig. We're in the KHOU newsroom. You can see behind us what we're talking about, and we are talking specifically about facts, not fear. And we have two people here that you have heard from a lot lately. We're going to get up to speed from both of them. We have Harris County Judge Lena Hidalgo, and we have Dr. Shah. He is Executive Director of the Harris County Public Health. And between the two of them, we are going to talk about the latest, and we're also going to take your questions. There's so many people out there that are either confused, misinformed, disinformed, and we just want to make sure that everybody's on the same page. So we want to start with the very latest. It's almost 4:45 on Friday afternoon. Where are we on the number of cases, and where are they?
Right, so the latest is in a broader region. We have 6 total diagnosed cases right now.
Okay.
We have, 3 in Harris County, 1 in Fort Bend, and 2 in the city of Houston.
Okay.
And the good thing is we know that all of these folks are connected via a trip to Egypt, so we're at a place where we're still in a position of containment. I do want to say I recognize the anxiety. These are the latest numbers from us, but we're all getting numbers from around the country, from around the world, and so we want to make sure, and the reason Dr. Shah and I wanted to come and have this conversation with the community is to make sure that folks know what the reality is, what we are working on, what the community can help us work on, but the fundamental message is, at this point, we are leaning forward, being incredibly proactive in making sure that we're doing everything we can to respond and to prepare for what may come next.
Of the 6 cases in our area, how many of them are in the hospital? Can you tell me how many are in the hospital?
I can tell you about our 4 cases. So
okay, so that's the 2 in Houston, and then there are 3. There are 3 in Harris County.
With Fort Bend County, so Fort Bend County had also 1 in the hospital, and so then we had our 2. This is why it becomes confusing.
Sure.
We had our 2 cases, and then we had the 3 with City of Houston, right? So 2 with the City of Houston. I'm sorry, 3 and 2. So I got it.
Okay.
5, yeah.
So with our cases, both of our cases were in the hospital that we confirmed positive yesterday.
Right.
Earlier, and then later we confirmed a third one.
Yeah.
And that person is also in the hospital. So we have 3 that are in the hospital for ours. Fort Bend County had 1 who is also in the hospital, so that's 4.
Right.
And the City of Houston has 2. I believe both of those were in the hospital as well, but I don't have exactly about the second one because that was just late breaking today.
Condition-wise, though, do you know?
Stable.
Well, stable in and of itself isn't really a condition.
I know.
So can you give us a little more information?
Yeah, and I think this is where the challenge is. I'm going to do the best to try to give
because we're not asking for names, and we're not trying to get addresses.
Yeah.
We're just trying to get a better idea of what state they're in the hospital.
Sure. So I think when we say stable in the medical field, we say it from the standpoint of that this is an individual who has not deteriorated to requiring a significant amount of care, for example, intensive care or ventilator, things of that nature. So when we're saying that somebody is stable, is that they've been admitted from symptoms, either they've had mild symptoms, or they may have even more of than that type of mild severity of their symptoms, so that they're admitted for that reason. When we say stable, we mean that we have not heard, or our healthcare providers have not foretold us that there has been, or relayed to us that there has been deterioration. So they're doing okay. Now, does that mean that the moment we get off this interview that something might change? Well, that's what happens in medicine all the time. So, but right now, stable from our standpoint is that they're doing okay. The challenge that we have is that we have moving pieces when it comes to even the healthcare side, and then there are moving pieces when it comes to the public health side. But the good news is that the cases that we have are all linked, as the judge said, to a specific travel to a specific country. But here's why it got complicated.
Okay.
It was
because Egypt was never on
That's
anyone's
why it was
radar,
complicated.
right?
So it was an exposure on a specific activity on a trip to Egypt. So it's not all trips to Egypt. It's not all times to Egypt. It's that there was somebody from a higher affected area that had also been on the same trip, and it exposed these individuals, and then they came back to our
So help us understand this. Were they all on a plane together? Were they all on a cruise, along the Nile together? I mean, how do we know? I understand that it's contained here, but what we're trying to understand here is there are going to be other people that were on the same trip in other parts of the world as well. How did they all come together, and do we know this information?
So we're investigating this.
Yeah.
And this is where we try to do our best to balance what we give, because we want to make sure that our team is able to continue to get that information, investigate that information, not feel that they're not able to have the space to do that, but also to be effective at it. I think that's key. But at the same time, we're trying to share as much as we can. So they were on a trip. We haven't said it was a plane or boat or this or that. We've said they were on a trip together. You've seen in the social media that there's been information about there was a cruise, things of that nature. We haven't confirmed that, but that's what's out there in the social media.
Okay.
The key is not the trip. The key isn't the country. The key is that they were exposed to a confirmed case. That's the key information. And that confirmed case exposure is what has led to these individuals also being confirmed cases.
And what I also want to make clear is our public health department is in communication with other public health departments as well. And so, of course, if there were other folks who were part of this trip, that's the beauty and the importance of us all working together. And that's what, Dr. Shah and his team and other teams have been running down, is who else might have been exposed to this trip, and who else might these folks that came back might they have contaminated here. Now, I do want to make a point about sharing the exact details of the trip. Folks have seen all over the internet, people are trying to guess out where these folks live who've been contaminated. They're putting pictures of
the 6
homes.
patients that we know of that are here.
And so it's very problematic, because we're asking folks, we need the community to help us with this, to help come forward if they feel that they may have coronavirus. But people are going to be scared to come forward if they think that that's going to result in their home address being plastered on the internet. And so we're running it down, but we can't give information that might help identify a specific person, because it's dangerous, it's a privacy issue, and it doesn't let us invite then other folks.
That's such a great point, because
Sure.
that's why there have been questions. Well, why are you giving a quadrant of Harris County? It's a lot of people, a quadrant.
Right,
why are you
right.
giving an age range? And the reason we're doing this is just exactly what the judge said, is that we're balancing the information that we want to give to our public and able to give, that's going to allow people to know that there is transparency and there's information out there, but also the privacy of that individual. So if I'm the individual, let me give an example, because I heard this.
Because sometimes the fear is not knowing. That is out there as well.
But here's where I was going to go with that, because that's I was hearing this driving over on the radio.
Yeah.
Which is, well, why not give me a less than a quadrant? Why don't that's lots of miles, lots of people? Why don't you start to make it narrower? So I started thinking that in my mind. Well, if I were in a community where I was given a quadrant, where would I want to go with that? I would say, next, well, don't just give me that quadrant, give me the zip code. Then I would say, well, you know what? That's not good enough. Give me the census tract. That's not good. Give me the neighborhood. Now give me the street, give me the home. I would want to keep going until I had more specific information. But that in the process also means that people, businesses may be hurt, that you might have more fear, paranoia about what's happening. And it may also, at the end of the day, hurt and jeopardize our ability to actually get other people to come forward.
And I get that, and I think we've seen that, and it's a sad state of affairs when certain parts of our community are affected. People won't go to certain businesses, and they won't patronize certain places, and that's unfair as well, right? The big, giant, broad paintbrush. But someone did ask on here. Kayla asked a question because we do want to get to some of these viewer questions. She says when all of them came back from that trip to Egypt, they weren't. And you can correct me if I'm wrong here, but they weren't all quarantined the minute they got back off that airplane or however they made it back here. They weren't quarantined from the minute that happened. Why can't you give the public some idea of where they went before they were tested and before they started getting sick and ended up in this situation as we're in today?
Yeah, and I was
just an idea.
Yeah, and that's what, I know this is hard for people to hear, but that's what our public health professionals do each and every day. That's what we do all the time. We do it for tuberculosis, we do it for other infectious diseases. This is what we do behind the scenes. And the judge knows this, that we talk all the time about how we're the invisible workforce. We're doing all these things behind the scenes. Nobody even knows that we're doing it. We do this every single day. Just that novel coronavirus, because it has taken such a concern across the globe, but also because everybody is focused on it. I mean, you can go across every channel right now. Everybody is talking about it. My kids are talking about it. One of my, one is 10. The other one is 5. He's talking.
They're
about
talking
it.
about it.
Even the 3-year-old is talking about. He can't pronounce it right, but he's talking about it. So it's in everybody's imagination right now. Everybody's concerned. Everybody is concerned about it. We're concerned about it. But the point is, at the end of the day, this is what public health does. This is what we do every day with diseases. And if somebody has been exposed, we are going to make contact with that individual. But again, because it's almost a needle in a haystack, because it's such a small group of people in a large 4.7 million people, we are really focusing on the people that we know have been exposed to those individuals.
Let me add something, because it has been explained to me in a way that I think would help it, if I explain it that way to the community. And it's a matter of assessing risk, right? And so what these professionals are looking at is who might these folks that went on a trip, who might they actually have contaminated, right? And so, for example, when they first got here, they didn't have symptoms. And so it's very low risk that there was a transmission at that time. Then once they develop symptoms, right, you're tracking, well, where did they go? They went to such and such place. Okay, well, we need to make sure that we go talk to all those people. And they've talked to those people, they've asked them to self-quarantine. So they're mapping, the folks that are likely to have been contaminated, letting them know, asking them to self-quarantine. If we went and said, this person lives in such community, everybody would be nervous. We would cause, unnecessary panic. I don't want, and I've asked my department and, everybody who's working on this, I don't want us to find out, like Seattle did, that these cases had been brewing that we hadn't heard about. And so that's why, even before the test came back positive, I said we need to make sure that even before we get the results, that we assume that these may be positive, and we do all the mapping, and that's what we've been doing, is trying to contain.
I want to switch gears because there are a lot of questions about the rodeo. We just reported it a short time ago, that the South by Southwest Music Festival has been canceled. They don't even have any presumptive positive cases in Austin, yet here we are with 6 as of right now. What considerations being given? What do you know about when it comes to the rodeo? There are a lot of people come to town for this. All kinds of people come to town for this. What about the rodeo?
So the first thing that I do want to point out is the containment phase conversation, right? That right now we're not seeing community contagion, and so that puts us at a point where we're not quite, if you tell people don't go to the rodeo, then don't go to school, don't go to church, don't go to all these other things. And so that's the balance that we're trying to figure out, is really it would be at that point that we would be considering this conversation. We just got the news also about South by Southwest.
So why did they do it then?
So that's why we still need to go run it down with our counterparts in Travis County. We just heard the news as well, and they've been in a press conference. So I'm about to, get off the phone, call over there. My understanding so far is that some of it is just the businesses that were taking part in the rodeo, they were coming, or in the South by Southwest, they were coming from out of town. So we will absolutely be asking these questions about our rodeo. I believe their rodeo is still on, and so I imagine it may be something about South by Southwest in particular, but we're absolutely not saying, under no circumstances will we look at the rodeo. It's just a matter of, when do you start asking people to not participate in mass gatherings, to not participate in life? And right now we don't have any evidence of transmission in the community.
That's right. That's exactly right. And I right before this conversation, I connected with a couple of public health colleagues across the state. And again, Judge is right. This is fast breaking, so it's late breaking. We don't have all the information.
Okay.
But what we are being told is that there were a lot of folks, including entities like Facebook, Twitter, Amazon, that were coming from other parts of the country, but really other parts of the world. There was this is an international festival. That was part of their equation. Some of them had pulled out, and so there was also that part was part of their equation. But the balance is exactly what the judge said, is that we have to at some point say, okay, if we cancel X, well, you don't just stop at X. Well, why don't you cancel X plus Y? Well, okay, now you cancel that, X plus Y plus Z. So if we feel we need to go all the way to Z, yes, we will do it. And judges, we've had these conversations, we will do it.
Every day, multiple times a day.
Multiple times a day.
Are we still okay?
Are we still okay? Absolutely.
Yeah.
But if we get to that point, then we have to say that let's not just have we're just concerned as in from an anxiety standpoint about something, and let's go ahead and cancel it without thinking of all the other kinds of mass gatherings.
What about concerts?
The
what
Rockets.
About
I mean,
about,
are we ready to say this is what we're gonna do? Some people may say, yes, do it. There are impacts to the community. I don't mean economic impact. I'm talking psychological impact as well. If we just say, okay, we are there right now, the next time you interview us, you're going to say, well, why did you exactly cancel everything else and you only had 6 that were travel associated or whatever that number is? So this is where the balance comes in. It's that being careful of not being too much, but at the same time balancing it with the science and the evidence that we have.
Of the 6 known cases that we have here, everybody, and I don't know if it was just older folks that went on this trip to Egypt, but everyone is in the 60 to 70 range. So the mayor had a press conference earlier, and it was brought up that those more susceptible are from 50 and up. What can you tell me about that? Because that brings in a whole lot of more people.
Sure. I think that, again, this is evolving information.
Yep.
And I know people. There's some fatigue to hear that it's evolving. It is evolving. We're learning more and more about this. We're learning about what's happening in China. We're learning what's happening in Asia. But we're learning even how this is behaving outside of the continent of Asia. It is that the older you are, the more likely you are to have a complication, because you're also more likely to have underlying medical conditions, comorbidities we call them. You may have another disease or another condition that's going to make you more susceptible. So if you then get a virus, you're going to be more likely to have a complication from that that's going to be more severe. That's really very much similar to what we say for a lot of diseases, including, I don't want to use the 3-letter word, flu. That's what we say a lot, right?
Sure.
Which is, look, if you are older with immunocompromise or conditions, other medical conditions, if you get the flu, get your flu shot, because if you get the flu, you're going to be more likely to have a complication, and sometimes that can lead to severe symptoms, and it can also lead to death. And that's what we're seeing globally as well, that the stratification isn't a cutoff from 60 to 70 or 70 to 80 or 80 and above. It's really a gradation. It's not that younger people can't get coronavirus and can't have a complication. If you remember, one of the first persons who actually in China first described this and was out trying to say, the physician who said, I'm out trying to tell people there's something going on, he died.
I remember.
He wasn't 50s. He was in his 30s. He wasn't 50s. He wasn't 60s.
Did he have an underlying condition? Do you know?
I'm
not sure. I never read that.
But I don't think.
But I will say, part of what we're doing and staying on top of is the science of everything. And
That's
we're
right.
even,
Sure.
you know, increasing the number of doctors we're working with just internally. You know, we're communicating with the medical center. We've got the brilliant researchers there. So how can we learn from what's happening in other places, from what's happening in other countries, and make sure that we are learning as we go along and modifying our strategy accordingly?
I know we don't have much time left, but can you give us an idea of how many people have been tested locally? Do you have a number on that?
We cannot.
Not even a roundabout number?
We can say that obviously there are people that have been monitored. We know that people that we have done our best to investigate, and based on that, very careful, thorough, as a judge mentioned earlier, thorough investigation, in which we do, by the way, all the time, again, with our healthcare providers. Our public health, our healthcare systems come together in making an assessment on whether somebody from that evaluation needs to be further diagnostically tested.
Yeah.
Many are not. It was not the right criteria, and I'll tell you, we've had a lot of myths and rumors, many who have not, and we've also had folks that we have tested. But we're purposefully in public health across the region not giving that information. We understand that people are asking for that information, but we don't think that that is going to be helpful. We really believe that it's important for us to focus on confirmed cases. When that information comes out, then and judge is committed to this, that we are
here's what I
giving
will
that
tell
information
you
as quickly as
is
possible.
we are focused on increasing our testing capability locally. Right now, as you guys know, the city can do, you know, about 30 or some odd tests daily. We know if this gets bigger, we're going to need more than that, and so we're working on that. We are working on, of course, there are dozens of people that are self-quarantined across jurisdictions, so we're constantly working with the different jurisdictions to keep tabs on those folks. And then the testing thing is, many come back negative, and so we don't want to make people nervous, and then they came back negative. So we are just confirming the positive cases, but if we see transmission in the community, we will share it. As we get more cases, we will share that, and we will continue to focus on increasing our testing capacity, on tracking people down, on working on the best science, and planning on contingencies throughout our county department and our hospital systems and our nonprofits. What would we do if this got bigger?
And one of the things that I was just going to say, along with what the judge just mentioned, is that we have gone through a number of emergencies over time. We have, as a community, we have gone through a number of really challenging times. The only way we come through that is when we all work together. And we, in this community, we have been prepared, we have responded, we continue to be prepared, we continue to respond. I'll tell you, every single day, Judge Hidalgo, every single day we're having a conversation, multiple conversations. What are we doing here? How are we doing this? What is it? Why is it? She's asking a lot of questions. The team is asking a lot of questions. And at the end of the day, we're doing everything methodically to work through it, but we also don't want to incite any panic, any concern, any fear. We want to help people understand this is what we do. We're prepared, we're responding, and when we see, because we went from if this is going to happen to when this is going to happen, to now we've had cases, so we've gone from if, when to now. When we see that we have gone to a different level, that something else is needed, something more drastic, rest assured, that's what we're going to do, because we want to protect our communities.
Chris Costa is one of our reporters, and he's got a couple of questions, and some of them are related to spring break.
Yeah.
Some of it?
Yeah, sure. And actually, you know, I'll ask you one that's coming from one of our viewers on our Facebook live stream right now. So Daniel is asking, because we've talked a lot about how there's no evidence of community spread, right? How are you testing? Like, what evidence are you looking at that shows there's no community spread? And I think that kind of gets to that question, that like unknown that creates that fear. If people understand that, then they can go, oh, okay, so I don't need to be worried about going to X place or Y place and not needing to know that it's this location is where the person last visited. Right. So how do you test for that?
So I think the first thing is that, so we have to remember how this has evolved, right? It evolved from mainland China. So first the criteria was, if you've been in the last 14 days in mainland China, first it was Wuhan, then Hebei province, then mainland China, that if you've been here, then we're going to test, right? That was when you were potentially concerned. Then it evolved to, okay, there are other countries where you've had this kind of transmission. Then it evolved to other countries that are having more, like Japan or Hong Kong or Italy, Iran, right? There are additional countries, but there are more localized outbreaks or even broader outbreaks that are happening in those countries. So now our guidance started evolving that, now ask travel questions for these additional countries. Then you started to see in the US, you started to see small number of cases. First it was, one city, then it was another city, but then you had a localized outbreak in Seattle. When you had a localized outbreak in Seattle at the long-term care facility, now you started thinking, okay, well, are we going to ask anybody that went to Seattle, we're going to test you? But it was still localized in that situation where we did not have any evidence of community spread until, and this was actually just prior to Seattle, that you started to see reports of Oregon, California, and Florida, where you had, we can't explain this to a travel. So now what's happened on the federal level is that there's been evolution of the guidance and the testing criteria, so that if we then get connected with an individual, whether by the healthcare provider or they contact a health department, and that individual now needs to be tested, as the capacity to test ramps up, then we can potentially ease the stricter criteria for how do we test. That's the way this is all evolved over the last several months. It's really been about where the risk is, the exposure. That's where it comes to. And now in time, I'm also going to see that we're going to have more of an ability to test broader than we were previously, not just based on the fact that there's going to be more testing available, which is absolutely a capacity issue, but it's actually going to be about the fact that we may want to look at what other criteria there may be for determining whether community spread is happening.
And to just add a little bit to that, part of what we've been doing also is, because there's limited tests, obviously, so focusing on making sure we get more tests so that we can test more, and we're working with our congressional delegation to get more funds and working with other partners to see what we can do. But also self-quarantining, right? A lot of the folks that are in self-quarantine are not exhibiting symptoms, so then it's not likely that they have it. At some point you go past the period, they never had any symptoms, so you're good. So we're having to triage, like Dr. Shah said, according to the federal guidance, but that doesn't mean that we're not asking folks to self-quarantine if we think they may have come into contact, if we think they may have been infected.
That's right. Now if a clinical provider, if a doctor says, look, I really believe there's something unusual about this. We've ruled out everything else. We've ruled out flu. We've ruled out a bacterial pneumonia. We've ruled out other reasons for this person to have symptoms or have a disease or have an illness. Now we said, that's somebody that we should test for. So this is how it works, is that healthcare and public health work together to really, at the end of the day, determine who should be tested based on that.
Okay. So Mayor Sylvester Turner was saying in a press conference earlier today, he was giving some different guidances about spring break and what families should or should not be doing. Are there any recommendations that you guys are putting out there for families? Should they not be flying at all? Is that something you guys have been talking about, considering anything like that?
We've talked about it. At this point, really, again, we're trying to be consistent with what guidance is outside of not just our community, but statewide, federal, as well as international. Those affected areas, first of all, some of those areas you can't go to, right, because the flights aren't available. But we're also saying that if you are looking to see that there is transmission in certain areas that you are concerned about, then make that decision that I'm not going to do that. Maybe I'm either going to go somewhere else, or I'm just going to do as Mayor Turner has said, a staycation, right? And stay here, right? There's a lot of business here, so let's do. I think this becomes a little bit more challenging over time, because then you start, well, okay, is it Seattle? Do we not go to Seattle? Do we not to go to California? Do we not to go to Florida? Do we not go to Chicago? I mean, this starts to become a puzzle that becomes more and more difficult to get people to make those decisions. So we don't make those formal recommendations, but we are saying that, look, certainly if there's a high area of transmission, do not go there. So right now, Italy is the concern, right? I mean, there's a lot happening in Italy. Do not go to Italy because of that reason. But what about London and the UK? we don't have any evidence. Does that mean a week or two from now that could change? And then you'll say, well, Dr. Shah, why didn't you say London? It was right next door to Italy. It wasn't too far away. You just had to go across a channel, and there you know, that. It just gives this piece of a reminder that all of us have to make good decisions for our own families as well. And at the same time, we do the best we can to give recommendations based on all the evidence that we have.
And we're still talking about this. We had this discussion also today. Yeah. If as this evolves and as spring break nears, we may put out additional information. For now, part of the conversation is with the school districts, for example. If you have a kid who is sick, please, connect them to a doctor. Make sure they stay home. Particularly, Rice did very well on this, where they saw folks that had come into contact with this potential case.
Right.
So they asked them to self-quarantine and flag them for us. So we are relying on the community to help us. We can't have a perfect net and seal everyone hermetically,
That's right. Sure.
So, but we need to partner with folks to use their common sense to say, okay, hey, somebody came from, a country that is suspicious. If it were me, I would choose a staycation, but we don't have a formal recommendation right now.
That's right.
We will consider that.
That's right. And one thing that I think comes to this, and you said this, that it made me think about this as well, is that, when folks go closer and closer to an area with high transmission, you're actually now playing the odds a bit, right? Because it may not be where you were going, it may be the plane ride back where lots of passengers somehow. So you are taking those risks. Now, some of those risks may be unavoidable, right? You had a family emergency. You had to be somewhere. You couldn't get some change of your tickets. Maybe there's something that you say, I have to make the trip. But if you are able to make a choice, or if you have not planned it yet, you haven't actually bought the ticket, and the kids really, by the way, this is true, kids really wanted to go somewhere. My kids really wanted to go. Spring break is today, by the way, starting until next week. They really wanted to go somewhere. I was like, maybe we won't go right now. It's not that you can't, it's that just be commonsensical about where you go and how you go about doing that.
And if you're sick when you come back,
then you
don't go to work,
That's right.
Reach out to your provider.
That's right. That's right.
So you guys know about this kind of genesis of this group that traveled to Egypt and then came back. Right. Do you know, are there more people that are in that same affected area from the interviews that you've done with these people that were expecting to come back, that maybe now you have like a heads up that, hey, we have some people who might be coming back? Is that the case? Is that accurate or no?
So we discussed the information is shared among the health and public health network as to who all, trying to suss out who all exactly went on this trip and track them all down. For the part in Harris County, unincorporated Harris County, these are, we've tracked everyone down for us. Now we're focused on any contacts they may have had. And other counties and other jurisdictions are doing the same thing.
And when you talk about the dozens of people that are self-quarantined, that's who you're talking about?
So the folks that are self-quarantined are folks who either we think may be infected or who may have been contaminated by those who we think or who have been infected.
That you have been in touch with, or that person that maybe was on that trip that's been in touch with?
No, that.
I'm not sure I understood your question. One more time.
Well, I mean, I would know if someone in my close circle has it and is self-quarantined, right? That information, as much as they're isolated somewhere, that information gets out. That's someone I know. Wait a minute, I saw them at church last week, or I saw them somewhere, and suddenly I'm concerned because I had some type of contact with them, versus somebody that you guys have found in the process of figuring out where all they've been and who they might have been in touch with. Does that make sense?
So that's what these folks have been doing.
That's right. That's what we've been. So as we identify those contacts, and then because now we have, as of yesterday, we actually had the lab diagnose confirmation. So it's also something that people have to remember, is that the individual was actually confirmed yesterday. So that means that now that is now an exposure to a confirmed case, which means now we go back to whomever that individual, and this is why it gets complicated, right?
Okay.
That individual, over what period of time, and also when they had symptoms and where they've been, and how much the contact was, right? Was it casual contact, couple minutes, I did a fist bump, we walked away, that was it? Or was it, hey, I was in the room with you for an hour and a half? There are just so many nuances to this, but that's what the epidemiologists are really good at doing. That's their job. That's what they do every single day. There are other persons that may be in a quarantine situation because they were coming from an affected country. So I just want to make sure that they're, so this is what we're talking about here, and that's really more where we talk about persons, not patient because they're not patients yet, persons under monitoring. That's where we monitor because they went to an area or they were exposed or something happened, and we want to make sure that they continue to, they're healthy and safe, but also the community is protected.
Okay, I know we have to wrap this up. I'm way over on my time with you, but we're at the weekend, right? It's Friday. People are going out. They're having fun this weekend. They're doing things with their families. They're going out grocery shopping. They're doing all kinds of stuff. What is the takeaway from what we've talked about here today and where we are?
You want me first? You want to wait? I'll go first and then let her close.
Okay.
So I would say that it's go about your business. That's the first and foremost thing, is go about doing all those things that you're doing. We want you to do those things. But at the same time, we also want you to be smart about how you do it, right? We want you to make sure that, first of all, if you're sick, and this is so hard to say all the time, but we say it every day, every week, month, year. If you're sick, don't go out and expose others.
Okay.
Okay? The other is hand washing. Now everybody's like, okay, I can't get hand sanitizer. Well, okay, there's something I remember called soap and water. You can use that. It's
effective.
In fact, more effective. So why are we all about the hand sanitizer? You can actually wash your hands. You can cover your cough. If somebody else in front of you or near you is really coughing and you think it's not just, I just drank this and now I'm choking. And but you really think somebody is sick around, move away from that person. So take some very commonsensical, I'm not sure that's the right word because I always use commonsensical. I think it's a word.
It's okay. It's working right now.
Common sense strategies to really protect yourself, not just for novel coronavirus, but for a variety of diseases, including the flu, the three-letter word, the flu, which, by the way, also impacts our community and impacts people significantly.
Okay. Judge Hidalgo?
I'll just add, know that we're being smart about this. If we feel there's anyone who even while the test comes back, these folks, we were already watching them. We were already asking them to be under self-quarantine even before their results came, reaching out to their networks. So we're looking out for folks to the best of our knowledge with experts and with best practices and all of that. We can't do it alone. We need the community's help. And so in addition to everything Dr. Shah mentioned, it's if anybody feels that they may have coronavirus, that they travel to these places, that they were in touch with someone who has it, or whatever it is, they need to reach out. Please reach out to your doctor, give them a call. If folks don't have insurance, they can call 211. 211 will connect them with a provider that doesn't require insurance. The tests are free right now, so folks don't need to worry about if we end up recommending that they take a test. It won't be a hit for them. Even for folks who are undocumented, all of the Harris Health systems will not ask for whether you're here undocumented or not. And so all of our public hospitals, folks can call. And so that's really what it is we need everybody to play their part. And as we have done, the minute we find out about these things, we send it out. I mean, yesterday we got the cases. I don't think it was even 30 minutes between when we had the confirmation and we sent out the press release. Same with last night. They came back at like 10 o'clock. And I said, it doesn't matter, it's 10 o'clock, send it out.
Sure.
That's the way we're doing this.
Okay, and we appreciate that, so we can get that out to our viewers as well.
And on the back end, just so you know, we're also sending information out to our healthcare providers, our hospitals, our healthcare system.
Got it.
So people should also remember that all the information that the teams are sending out is also being matched with clinical guidance, evolving guidance that's going to our healthcare providers, and that's also critical. So that way, if somebody goes to their healthcare provider, they've gotten something, and now we can match that information. So I think it's worrisome for people, and yet at the same time, we're working through this, and we're going to work through it together as a community.
All right. Dr. Shah, Judge Hidalgo, thank you so much. And while they're taking off their microphones, I want to pass along one more piece of information. It's in the comment section of this video. If you want information right now, the up-to-date information, you can text the word FACTS, F-A-C-T-S, to 713-526-1111. It's a text message. You send that to us. We will send you back a link with the latest information about the coronavirus. Thanks for joining us, everybody.